The advantages of Doppler sonography are that it is minimally invasive, widely available, does not use ionizing radiation, neither the use of contrast material. The sensitivity is 93% and the specificity 99% for the detection of proximal deep venous thrombosis of the lower extremities. The disadvantages is that it is operator dependent. The differentiation of acute versus chronic versus recurrent thrombosis is not always possible. It is limited for deep vein thrombosis distal to the popliteal veins with a sensitivity of 60 to 80%. The normal vein on Doppler sonography of the lower extremities is characterized by easy compressibility, and by Doppler studies there is spontaneous flow that varies with respiration, and there is a flow augmentation following distal compression. Acute deep venous thrombosis on Doppler sonography of the lower extremities is characterized by a non-compressible vein. By Doppler examination, there is asymmetry in respiration-induced phasic venous flow, and there is absent flow augmentation. Hypoechoic filling defect within the anechoic lumen of the vein is another finding. This is a normal study showing to your left the popliteal artery and the popliteal vein. On the right, following compression, you can see that the popliteal vein collapses while the popliteal artery remains. The static image is seen on your left, and on your right, note the dynamics that occur when, by compressing the vein, it collapses, indicating that there is no thrombus within the lumen. The findings in venous thrombosis are illustrated on the right side of the image. Note the similarity of both because on the right side the vein fails to collapse upon compression. The static image to your left shows the distended vein. On your right, you can see from the dynamic study the lack of compressibility of the vein suggestive of thrombosis. This color image shows the confluence of the right common femoral vein, the superficial and the profunda. Note at the bottom right the normal tracing indicating free flow through these veins. This is an example of thrombosis of the left external iliac vein. Note the absence of flow at the site of the thrombosis and the flat. These next two cases show the effects of compression of the femoral vein with, in this particular case, normal flow augmentation when the extremity is compressed distal to the transducer. In this Doppler study, note the normal venous flow augmentation following compression distal to the transducer. In this patient with thrombosis of the proximal left superficial femoral vein, one can observe absence of augmentation of flow as a sign of thrombosis of. Note the filling defect within the vein due to thrombus. Note a non-homogeneous flow through the vein which has the filling defect secondary to the thrombus, and when rotating the transducer we see the artery pulsating normally above the vein and the defects are present within the lumen of the vein. Doppler sonography of the upper extremities in normal cases will reveal easy compressibility of the axillary vein, and on Doppler studies one may observe pulsations from the right side of the heart in the subclavian and jugular veins. In acute vein thrombosis of the upper extremities, one will observe a non-compressible vein in the axillary region. In Doppler studies, absence of flow and unilateral dampened cardiac pulsations elicited in the subclavian and jugular veins. Filling defects may also be observed. In this patient with thrombosis of the right subclavian vein, one can see a filling defect in this vein and changes in the cardiac pulsation due to partial thrombosis. Indirect signs in this case that had thrombosis of the left subclavian and axillary vein was that although in the jugular vein one can see free flow, the pulsations are abnormal. Sagittal and transverse images of the inferior vena cava revealed the absence of flow due to thrombosis.